Hello, everyone. I'm Dana Corson, Director of Media Relations for the National Academy of Medicine. Thank you for joining us this morning for a webinar on our report that was just released titled Global Roadmap for Healthy Longevity. You can now download a copy of the report at nam.edu/longevity roadmap. For those of you not familiar with our study process, for each requested study, committee, or in this case, commission members are chosen for their expertise and experience and serve pro bono to carry out the study's statement of task. The reports that result from the study represent the consensus view of the commission and must undergo external peer review before they are released, as did this report. I'll now give a brief overview of what to expect for this webinar. First, it's scheduled to last 1 hour. We will begin with introductory remarks from Victor Zhao, President of the National Academy of Medicine, and then we'll have a presentation summarizing the report by the commission members, who I'll introduce momentarily, and then we'll open it up for questions. Simply use the button below the live stream to submit questions using Slido. Also, just to note, the slides presented today and a recording of the webinar will be available next week at nam.edu/longevity roadmap. And now I'd like to introduce the members of the commission that wrote the report who are here with us today. First, we have Dr. Linda Freed, Commission Co-Chair and Dean of Columbia University Mailman School of Public Health and Director of the Robert N. Butler Columbia Aging Center. Next, we have Dr. John Wong, Commission Co-Chair, and Isabel Chan, Professor in Medical Sciences and Senior Vice President of Health Innovation and Translation at the National University of Singapore. Next, we have Dr. Isabella Abodaran, Professor of Gerontology and Perivoli Chair in Africa Research and Partnerships at University of Bristol. And last but not least, Dr. John Beard, Professor of at ARC Center for Excellence in Population Aging Research at University of New South Wales. So now I will turn it over to Dr. Zhao to get us started.
Thank you, Dana, and good morning and good afternoon, good evening. Oops, am I still muted? I'm not, great. I'm Victor Zhao, the President of the National Academy of Medicine, US. It's my great pleasure to launch this Global Roadmap for Health Longevity report. I think this is a very important report. It will provide recommendations to leadership, public and private, nationally and globally, on planning our society for the future. You know, the report's taken over 2 years because of COVID, but I believe the report is stronger than ever because of our experience in COVID, and of course, the disproportionate impact on the elderly. So let me have the first slide, please. I think we all know the world is aging. And today, 8.5% of people worldwide, about 120 million, are over 65. And by 2050, this projected to more than double, reaching 1.6 billion. And of course, when you look at the global population of people age 80 and over, it's expected more than triple. At the same time, fertility rate is dropping. And what you see in this slide in the upper left corner is a drop in fertility rate. And the upper right corner, I think is a very telling slide, is the trajectory of those over 60, which is shown in the yellow, and those less than age 5. At 2020, year 2020, you can see the two lines cross each other. In other words, we're going to have a lot more people who are older than younger people that will replenish, if you will, the population. And what you see in the bottom is the population pyramid, where in 1950s, we're seeing truly a pyramid with more youth at the bottom than the more elderly on the top. You can see over now and project in the future, this pyramid is going to be quite different. And people even see an inversion of pyramid if we continue this trajectory. Next slide. So what are the implications? Well, this demographic shift, if you will, change, impacts the society in many different ways. Families, communities, societies, industry, and economies in both industrialized and developing countries. First of all, we all know the rates of chronic disease and disability are rising rapidly, particularly in the older population. The health systems are facing increasing complex patient profile and rising costs. US alone, the Medicare expenditure is expected to project almost double by 2050 than as part of the domestic GDP. And of course, social insurance and retirement programs are becoming strained as number of dependents increases. And of course, when you think about workforce size and composition, they'll be particularly impacted as baby boomers transition to retirement, leaving major skill gaps in the workforce. Next slide. This is why we here talk about how to achieve healthy longevity. Healthy longevity is not just about living longer, it's about living healthier, more productive life, whatever your age. It's more than just physical health. It also includes mental, social well-being. It's really characterized by learning and growth, diverse and intergenerational relationship, and engagement in productive, rewarding activities and work and society roles with meaning and purpose at every age. This is what it is, the longevity dividend. If longer lives in good health are combined with structures needed to enable healthier older adults to be productive, engage in life, society, individuals of all ages will benefit. You're going to hear that from the report. So there are many upsides to getting older, and that's what I'm saying. So the older population represents a tremendous opportunity for every industry. We call the silver economy, right? It's estimated the value of this new market, if you will, is about $15 trillion by 2020. And so when studies have shown that older people are happier, more satisfied, less depressed, and less anxiety, less stress than younger people. Well, certainly I feel more satisfied, not depressed, and not anxious, but very happy about what I do, as is my colleagues too. So we realize that health and longevity, however, requires a life course approach. So it's not really talk about when you get older, but you start throughout your life to be healthy, being able to therefore maintain this throughout life. Next slide. This is why it's so important that societies have to prepare socially, scientifically, financially for longer lifespan. It's a global imperative. This slide shows you already a number of very important studies which has been carried out by WHO, African Union, ARP, and others. But it is felt that there's still a need for a comprehensive effort to assess the challenges and opportunities presented by global aging through the levers of health, socioeconomic enablers, policy, and practice. And that's what we're trying to do. We need science, technology, innovation to increase health span, transform the field, and generate this longevity dividend. Next slide, please. So this is why the National Academy of Medicine in US launched this global grand challenge on healthy longevity. You can see we launched it in our building with great attendance from many different countries back in October 2019. Next slide. And really important component grand challenge is this roadmap we're going to talk about today. The grand challenge will address the challenges and identify opportunities for global population aging. It should catalyze change to promote health and longevity, to catalyze breakthrough ideas research that extend years in good health and generate transformative and scalable innovation worldwide, and enable everyone, all the stakeholders, to work together to achieve the promise of health and longevity. Next slide. So with that, we appointed an international commission. This commission is charged to answer this question about what do we need to do to enable health longevity. Now, to make it truly global, international, we in fact appointed an international set of experts and thoughtful leaders consist of 17 eminent individuals representing 8 different countries in 6 different continents. They come from public-private sectors with expertise in gerontology, geriatrics, social determinants of health, behavioral health, built environment, business sector, workforce, economics, healthcare delivery, financing, science and technology, and certainly financing as well. And we're very lucky, as you can see, this commission is co-chaired by Dr. Linda Fried, as you'll hear from her, and Dr. John Wong. Linda's from the United States and John's from Singapore. This commission worked really hard, and I'm really grateful to them for presenting this really important report. Next slide. It's overseen by an international oversight board of 12 distinguished individuals from foundations, business, government, academia, represent 6 countries and 4 continents. And the board oversees the project, provides strategic guidance, dissemination opportunities for this project. And I'm very pleased to be one of the co-chairs, along with Joanne Jensen and Keizo Takemi. Next slide. So importantly, what do we ask the commission to do? Well, the commission is to answer these questions. How to strengthen communities and enrich lives of older people, explore and recommend approaches to enhancing structures, systems, and environment in our society, each country, and globally, to identify and analyze potential approaches and reforms across the entire spectrum of institutions and systems, and to identify avenues for innovative age-related research, and finally, to coordinate with other global initiatives to achieve an integrated and synergistic effect. And they've done a fabulous job. You hear this. I'm so pleased, so proud. I believe this report is going to have great impact. And I hope that leaders everywhere, public, private, will take on the recommendations and to really move forward as this global imperative to make a difference. Final slide. This is a cost of inaction. If we don't start doing things now, planning and moving, we're going to end up with more people living with poor health, suffering, and dependence. And the GDP that is lower than it would be for better health and full inclusion of older people. We're going to increase the fiscal burdens on the government and the burdens on individuals and families. And of course, we're going to have lost opportunity for people of all ages, young and old. So let me stop here by simply thanking the commission, the IOB, and particularly our staff for working so hard for over 2 years. And let me now, therefore, pass this over to Linda Fried, one of the co-chairs, for her vision for health longevity. Thank you.
Thank you, Victor, and good morning, good afternoon, and good evening. I'm honored to be with all of you and thrilled to have you join us. What I'd like to do on behalf of the Commission is to share with you the alternative to the cost of inaction, which is a vision for what healthy longevity could mean for all of us as individuals, as communities, and as societies. To arrive at that, the Commission chose a distinct approach of creating a vision that starts with the endpoint, setting a vision for what the evidence says could be accomplished to transform societies for healthy longevity and longer lives by 2050. With 2050 being far enough into the future to have accomplished tremendous change and close enough to be relevant in many of our lifetimes, with particularly people in their 20s today who will be entering older age by 2050. What we envisioned, based on the scientific evidence of what is possible, is that we can create long lives, not with illness, but with health and function. That's what the evidence suggests is that people with health in older age can then have the full opportunity to engage in meaningful and productive activities that meet their goals, and to bring their social capital, which is unprecedented in both capabilities and scale, to society, that will contribute both to strengthening economies and to intergenerational well-being and cohesion. That this vision is for all people, including but not limited to older people, and that the results would be all of society benefits from the return on developing healthy longevity for all, and particularly creating equity so that all older adults who currently face barriers in terms of health or full participation in society can thrive. We recognize in this that a society of healthy longevity in 2050 will understand the immense value that older people bring to all generations and to flourishing of society as large. And that when older people are thriving in the ways that we envision, all people will thrive. And we emphasize that the relationship between old and young is critical in this, and that achieving healthy longevity in the ways that we will suggest will enable the next generation of older people to live long lives with health, in which they, as well as people of other age groups, are valued and able to contribute in meaningful and productive ways. And finally, we emphasize that equity must underpin this vision for 2050 and the investments that are made to accomplish this. Next slide, please. Now, that vision for 2050, which you will find in much more detail in the Commission report, is anchored in the evidence that we now have of what is possible. Research in recent decades has shown us that it is possible for people to live most of their lives in good health, so that their longer health span can approximate their now longer lifespan. And that to that end, prevention works and matters at every age and stage of life. That all generations will benefit when barriers to older people's full participation due to health and due to transformations of society are eliminated. And particularly that there is the potential for huge return on investment for individuals and society from investments in social health and physical infrastructure that can improve health at all ages and enable older people to be engaged, whether in work or volunteering, in ways that they value and that strengthen communities and society. It's notable that many of the things that we've learned in last decades really contradict myths that many of our approaches and policies are built on. For example, a common myth is that older people working prevent younger people from having jobs. And in fact, the evidence is very strong that workforce participation among older people is positively correlated with jobs for younger people. And also that intergenerational teams are both more productive and innovative. This is just one example of numerous myths that are held that our current policies and social organization are really work around, but have been disproven over the past few decades. Next slide, please. The Commission envisions a virtuous cycle of healthy longevity, where the creation of health across our now longer lives increases the ability for individuals and society to realize the full potential of human, social, and financial capital. And that the realization of this can strengthen society and communities themselves, bring dignity and worth and satisfaction to individuals, and support the ability of societies to further invest in human and social capital, as well as building the infrastructure and enablers of a society for longer lives. In all of this, equity and social cohesion must be at the center for this virtuous cycle to succeed. And we recognize that these investments will have high return, and through accomplishing the resolution of the disruptors in the top right of this stage, which adversely affect our ability to create health and well-being across our no longer lives. Next slide, please. The Commission arrived at 5 principles for societies and of healthy longevity. That the goal here and the principle is that people of all ages, and in the focus of this report, particularly older adults, are able to reach their full potential to live life with good health, functioning, meaning, purpose, and dignity. That the best health and functioning possible at all ages is enabled, meaning that societies are investing across the full life course, because the development of good health into older ages is a cumulative life course proposition. And that societies will be successful in reducing disparities and enhancing equity, both within countries and across countries, essential to laying the groundwork for all people to experience the opportunities of being healthy through no longer lives. And finally, that the human, financial, and social capital of older people is realized through the investments that will be needed, with large returns for individuals and for society at large. And finally, that we join together as a world to use data and meaningful metrics to track the achievement of outcomes and guide decision-making. Next slide, please. There are many relevant sectors and actors to accomplish this. In fact, the creation of healthy longevity, which the evidence says is more than possible, healthy longevity for all, will require all of society engagement from individuals, all levels of government, and the NGOs and the private sector, including both employers and labor unions. Next slide, please. The report is divided into 4 domains that must be addressed, all of them, to achieve healthy longevity: social infrastructure, physical environment, health systems, and the resulting longevity dividend that will be realized through investments in lifelong education and the opportunities for work and volunteering, if desired, in retirement. Ultimately, in the long term, societies can generate more value for less overall investment through simultaneously investing in these 4 different domains. Next slide, please. So the Commission created a roadmap designed to recognize that a large proportion of health is determined societally across many sectors, a complex system of factors that have to be shifted to design and implement a society for longer lives, which we do not yet have. It will require, starting now with 2050 as the goal, but identifying key levers and starting points that could propel the vision, bring short-term returns, and amplify commitment to ongoing implementation. And so the Commission has identified key levers for the first 5 years, starting now, to initiate an all of society transformation for societies of long lives with health, in which all older people, because of investments across the life course, have the opportunity to age with health and to be engaged in society in ways that deeply matter. Thank you. I'll now turn to Isabella Aboderin to talk about the social infrastructure enablers to accomplish this.
Thank you very much, Linda, and good morning, good afternoon, and good evening. It's my pleasure and my honor now to speak to the report's recommendations for action on social infrastructure. Next slide, please. So the report considers the critical role of social determinants of health in shaping prospects for healthy longevity. The report recognizes that such social determinants, as captured in this figure, have more influence on health than the provision of healthcare has, and that they need to be addressed over the entire life course, because adverse exposures in early life set the stage for health status and trajectories in later life. The report does not attempt to address all social determinants comprehensively. Rather, the Commission prioritized a subset of social determinants in this chapter of the report and in the physical environment chapter. Next slide, please. In relation to social infrastructure, the report focuses on 5 key targets for action. First, the pro-social strengths of older adults, which manifest in a desire to help others and which constitute a resource to communities in need of social cohesion. All too often, however, these strengths are not or not sufficiently recognized or fostered. Second is ageism, which the World Health Organization identifies as a neglected global health issue and which contributes to disparities faced by older adults in social programs, housing, healthcare, and employment. Third is social inclusion, which can help to combat loneliness, build intergenerational connections, and increase social cohesion. Fourth is the lack of financial security, which affects older people in all countries, but is particularly pronounced in low and middle income countries where many people have no access to pensions. In sub-Saharan Africa, for example, only 23% of older adults above the retirement age receive a pension. The figure for Central and Southern Asia is 26%. In Europe, more than 95% receive a pension. The fifth and last key target is the digital divide, which exacerbates inequality at all ages and on multiple levels. Next slide, please. Considering these key targets, the report's 2 major goals are, first, to see social cohesion augmented by intergenerational connections and the creation of opportunities for purposeful engagement by older people at family, community, and societal levels. And second, to see comprehensive social protections and financial security that mitigate the effects of financial vulnerability at older ages. Next slide, please. To achieve these goals, the report highlights the need for action to foster a range of core supporting structures. These include laws and policies to eliminate age-based discrimination, public information campaigns that disrupt stereotypes and promote the value of older people, multi-generational advocacy to fight age discrimination and to accomplish shared goals, multi-generational approaches to policy and action to strengthen social cohesion and reduce loneliness, pension and social protection systems that explicitly include people outside of the formal economy, programs promoting individual savings and financial literacy, and lastly, access to secure banking systems and investment opportunities. Next slide, please. For the next 5 years and to initiate transformation in social infrastructure, the report makes 3 main recommendations. First, that governments should develop evidence-based, multi-pronged strategies for reducing ageism against any age group. Second, that by 2027, all governments should develop plans for ensuring basic financial security for older people, recognizing global disparities in access to pensions. And third, in order to improve financial security in retirement, that governments and employers together should develop strategies for increasing financial literacy, as well as mechanisms for promoting pension contributions, self-funded pensions, and lifelong savings. Next slide, please. The report speaks too to the costs of inaction on these recommendations. The examples on this slide point to merely a few of these costs, financial as well as in terms of health and well-being, that would accrue to individuals, families, and societies. Next slide, please. And finally, the report considers likely returns on investments in transforming social infrastructures. evidence on the positive effects of old age-focused social protection schemes on social cohesion, as well as evidence on the association of social engagement with better physical and mental health speak to this. But just as the examples on the previous slide underestimated the total cost of the status quo, these indications do not even begin to describe the measurable and intangible benefits that could accrue if social infrastructures for healthy longevity were realized. And with that, I'd like to thank you and hand over to Dr. John Wang. Thank you.
Thank you very much, Isabella. And good morning, good afternoon, and good evening. It is also with my great honor and pleasure to join all of you for the launch of this very important report. Next slide, please. I will be speaking about the physical environment. And the physical environment affects the way we live, learn, work, and play throughout our entire life course, for better or for worse. The global ecosystem, the natural environment, the built environment all impact on our activities, the local economy, our community, our lifestyle, and ultimately on our entire community as individuals. In fact, WHO estimates that at least 24% of death and disease can be linked to environmental hazards. So this is a fundamental issue that we have to address if we want to achieve our vision of by 2050. Next slide, please. So the Commission has identified 6 key targets that it would like to address. These key targets pertain to all ages, but because older people tend to have greater challenges, we would like to particularly call out housing, which meets the needs, both in terms of allowing functionality as well as safety, and even, as the next speaker will show, transformation of care so that we can get healthcare delivered at home. Public spaces and infrastructure to enable people to exercise, to get out, and for social cohesion in a safe and incentivized way. Safety, critical, especially when people are in their older age. Transportation, and especially public transportation, and in public transportation, really addressing last mile gaps. Isabella spoke about the digital divide and the importance of making sure that digital technologies are in place so that societies can benefit from what technology offers. And then lastly, the issue of climate change and the environmental hazards which our populations are all going to face. So the goal by 2050 is to have physical environments and infrastructure that can support both functioning and engagement for people of all ages, and especially at an older age. Next slide, please. So these are the supporting structures that need to be put in place. Very importantly, we need to include older people in co-design of the built environment. It should be built not through the lens of older people, but with older people, so that we can understand, again, from all ages and from different cultures, what do people want and how can we allow people to remain in their communities. Public spaces that promote social cohesion and intergenerational connection, while also encouraging physical activity. We need age-friendly communities and housing design protocols that enhance access to food, transportation, social services, and engagement. And because because climate change and environmental emergencies do have a disproportionate burden on older populations, we need to have programs to mitigate the effects of heat, extreme weather. And to benefit all populations, we need to reduce air pollution, especially from fossil fuels, which will also help the environment. Next slide. So the Commission calls for 5 recommendations, and these recommendations are with both through the government and private sector partnering together, and as I mentioned, to design user-centered physical infrastructure that allows cohesion across generations. This should be at several levels. So at the city level, really, again, trying to develop mitigation strategies to address issues of air pollution, climate, severe climate events. At the neighborhood level, ensuring that we have infrastructure that allows people at the neighborhood level to live, learn, work, and play as a community. So what are the learning opportunities? What are the work opportunities? What are the play opportunities in the neighborhood? And then at the home level, ensuring that the physical infrastructure addresses the challenges as populations age in terms of safety, allowing functionality. And one can actually say that certainly by 2027 and even by 2050, a significant amount of the housing stock has already been built. So how do we make sure that the existing housing stock meets our needs? Next, broadband access. This whole meeting is being conducted virtually. And the importance now of broadband access for everything from delivery of healthcare to ordering food, social connections, as well as learning and even healthcare delivery. And then lastly, designing public transportation options, because most of the world depends on public transportation. And very importantly, addressing first mile and last mile needs. And this is something that we need to call on companies, foundations, and local governments for implementation. Next slide. What is the return on investment? Well, there's the Commission's report quotes some examples. So for instance, a study in 2017 showed that providing housing and support services reduces emergency room visits and hospital stays and can generate a return of investment of $1.57 in United States dollars in savings for every dollar spent. Investing in broadband shows that you can increase GDP by 0.3% if you double broadband speed. And it also has this positive effect across middle and high income countries, and certainly will benefit low income countries too. And finally, the last slide, in terms of investing in community gardens allow older adults the opportunity for exercise as well as social interaction. And in Gambia, studies show that community gardens created jobs, empowered women and youth, and enhanced food security, nutrition, and health. So these are just some of the examples that the report calls out on the importance of investment in the physical environment. I will now pass over to Dr. John Beard to discuss health systems.
Thanks very much, John, and greetings, everybody. This work on health systems was very heavily informed by a meeting which was convened in Singapore in 2020, just before the pandemic started. And I'd like to thank all the participants for helping us in our work. One of the things that came out of that meeting was an understanding that while older people are often stereotyped as frail and dependent, the reality is that most people over the age of 65 actually live independently, but most people over the age of 65 also experience multiple chronic conditions. And so the work of the Commission focused very heavily on how we can prevent and better manage these chronic conditions, and thereby ensure that we maximize health and functioning as we age. And you can see here on the slide the goals which we set. The first was to ensure that we had integrated public health, social service, person-centered healthcare, and long-term care systems, and that these were designed to extend years of good health rather than just focus on throughput. And the second, which we particularly wanted to emphasize, was the need for high, middle, and low-income countries to develop quality long-term care systems, which will enable people, even with significant losses of capacity, to continue to live lives of meaning, dignity, and purpose. Next slide, please. So to achieve this, the sorts of structures which we need to span a whole range of services. In terms of public health, we need to focus on the underlying risk factors for aging and for chronic conditions. We're increasingly understanding how the biological systems that underpin disease as we grow older and which are associated with aging may be targetable in themselves, and we need to better understand that. But we mustn't forget the social determinants of health that Isabella spoke about earlier. And we need to make sure, because as people age, we see increasing diversity in their experience of health. And that diversity isn't random. Often the people with the worst health are the people who've experienced the cumulative impact of disadvantage across their lives. So we need to make sure that as we focus on health systems, we also think about the social determinants, which mean that those people with the worst health often have the least access to the resources they need to address their needs. And finally, we need to be thinking about, and this became highlighted, I think, through the pandemic, about much better systems, data systems and analytic systems for surveillance, precision public health, and the assessment of the efficacy of the interventions we put in place. Next slides, please. But so we need to focus on prevention and primary care, but we also need to think about the health services themselves. And here the focus needs to shift from the systems which we currently have, which were often developed to treat independent acute conditions, cure them and see the end of the person. We need to understand that chronic conditions require chronic management, and that requires integrated and person-centered care. And person-centered because everybody's needs are different, and the care they receive can be tailored to meet those needs appropriately. We need to have much better primary care systems that include preventive screening, address risk factors for chronic conditions, and promote positive health behaviours. We need to have much better sharing of health records and the development of goal-based plans in conjunction with the clients themselves. And we need to ensure that there's a collaboration with social services so that, as I mentioned before, social determinants are not overlooked in all this work. Another crucial thing is to ensure that we have an adequate geriatrics workforce, and this is an undervalued part of the medical profession in many countries, and we need to shift and raise its profile and ensure that we have an adequate number of geriatricians for the growing needs which we will see over the next 20 years. And we mustn't forget the end of life, and we need to develop much better systems of palliative and hospice care. Next slide, please. Also, and I was really pleased that the Commission was very solid in their support for, we must not forget long-term care. And when we talked about long-term care, it wasn't just about institutional care. What we realize is that most older people express a desire to, if possible, receive care in their homes or in their communities. And so we need to develop new and innovative systems which ensure the delivery of care in the place that the person chooses. And we need to think about how we can fund that in a sustainable way. We need to make sure that those systems don't just focus on the basic things and dignity, but also ensure that people, even with significant losses of capacity, have lives of meaning, dignity, and purpose. And in doing that, we need to not forget the caregivers, particularly family caregivers, ensure they have adequate support, training, and help to do the jobs that's expected of them. And in doing that, we're hoping that technology will be able to provide some opportunities for providing information and providing better surveillance and monitoring of people so we can identify when the needs that they have much earlier. Next slide, please. So the recommendations we had are here. To achieve the goal of the best possible health for older people, governments should, over the next 5 years, develop strategies for increasing investments in robust public health systems that can build and lead collective action for promoting health at the population level and across the life course. This is actually crucial, and we're at a critical juncture, I think, after the pandemic, where people realize the systems we have are inappropriate, inadequate, and we need to invest to do better. We need to shift the focus of health systems away from throughput and towards achieving healthy longevity. And particularly, we need governments to consider how we can develop health and long-term care systems that are integrated, and how researchers can develop strategies for making available culturally sensitive, person-centered, and equitable long-term care. Next slide, please. And there's very clear evidence that there's a strong return on investment for these sorts of investments. In terms of individual health, there's evidence that if people can adopt healthy lifestyles in midlife, it may add up to 10 years to their lives. And in terms of the economy, we know that those investments, for every dollar that's invested, we get between $14 and $30 back in terms of the return. So there's a very clear case for investing in this area. And with that, I'd like to pass back to Linda.
Okay. Well, I think Linda's having some technical challenges, so I'll step in. So Linda, please feel free if you're ready to go. But so I think that the Commission has shown that in terms of labor force, over the age of 65, there's a disproportionate burden of low-income countries still being involved, especially in labor at an older age. And as in high-income countries, the proportion is low, but certainly in high-income countries, there is a great interest and desire to continue contributing. Next slide, please. So the Commission identified 3 key targets that it wanted addressed. The first on work and retirement, the second on volunteering, and the third on lifelong education and retraining. The goals by 2050 included unleashing the economic and social benefits generated by people living, working, volunteering, and engaging longer. Very importantly, the social infrastructure that's required, the institutions and the business systems that enable work to be safe and meaningful, and allowing the community to engage at every stage of life. And in terms of education and training opportunities that allow people to participate in lifelong learning and growth, because our current educational structures very often are not geared to older and more mature workers. Next slide, please. So what are some of the supporting structures that we would like to see in place? The first is that we would like to see an increased older adult participation in the paid workforce as well as volunteer roles to allow societies to benefit from this pool of human and social capital. But we need incentives in place because there are many people who would like to continue working, who have challenges, and there are policies and unfortunately barriers which need to be addressed. So we need to have incentives in place to recruit and retain older workers and to make sure that older workers who continue working, jobs are created which take into account their preferences, physical strength, as well as capabilities. And as mentioned, we need to address policies and incentives because there are policies and incentives across countries which inadvertently may actually impede people remaining or joining the workforce. Next slide. Volunteering is a critical component of how people can contribute at older ages because, again, the evidence have shown that people do want to contribute and give back, especially with a greater amount of both with time as well as experience and wisdom. So we need formal programs to provide in place rather than ad hoc programs. We need to relook at the way, again, education is delivered and has to be age appropriate in terms of the way education is delivered. And as workers and as people go through life and experience several different career changes, we need to make sure there's expanded access to education, vocational training, and higher education to make sure that we can upskill workers of all ages. This requires involvement of both employers, unions, as well as the employees. Next slide, please. We need to make sure that governments work in collaboration with the business sector to design the work environment and to make sure that the policies are there to allow people to remain in the workforce safely. And again, redesigning our educational systems. And this is required, especially because we think that the science of learning and the science of education delivery is very different for an older population than a younger population. And why is this investment so important? Next slide, please. This is data from David Bloom and colleagues published in 2020, where they looked at the economic contribution both in Europe and the United States for people over the age of 50. And it was stunning to see that older adults contribute 29% in Europe and 40% in the United States of GDP growth through both market and non-market activities. And this is without any formal structures in place. So not a small figure, which should be neglected, but really built upon. Next slide, please. Again, the evidence shows that people in high-income countries, well, they want to work, and many of them need to work more years to support their lifestyle. And having the health as well as the education enables them to do so. Andrew Scott and colleagues have shown that just in the United States, delaying the onset of chronic conditions by 1 year can generate $37 trillion just in terms to the economy. Age diversity, there's data to show that age diversity improves team performance. So multi-generational teams in several settings, including complex, including roles which involve high degrees of complexity, that age diversity improves team performance, with older workers having greater resilience as well as experience, and younger workers having a lot of energy, a lot of drive, able to pick up very quickly on technology. Combining them together leads to superior team performance. And there is data to show that when you, as Linda mentioned earlier on, that labor force participation rates, if among older people, actually is positively correlated with labor force participation rates of younger people. So older people do not, remaining in the workforce, do not jeopardize younger people from entering the workforce. Next slide. But there are challenges. There are challenges that we need to address. The first issue that we have to address is that if we don't invest in healthy longevity, there are going to be substantial numbers of people, especially people involved in jobs involving high degrees of physical labor, who are going to be in poor health and will have difficulty in terms of remaining in work and have to transition out, and we have to address issues of unemployment, disability pensions, and early retirement. Age discrimination remains an issue, and how it does affect the ability of older people who want to remain in work but can't. And we have to be careful here, because if we say raise retirement ages bluntly, people may, although they want to work, they may have difficulty working because either they can't find appropriate employment, or there are challenges, and therefore they may have difficulty claiming pensions. And very importantly, now we're seeing the challenges of workers in informal and gig economies, that they lack financial protection. Finally, talking about volunteering, there is a lot of data that formal volunteering in later life actually is good for people's health. It supports healthy longevity, enhances a sense of meaning and purpose, and provides value to societies, both social value and even financial value. There is positive effects on mortality risk, cognitive function, depression, physical function, positive effect, happiness, and studies even to show anatomical changes in the brain and biological changes in cytokines. Next slide. And so finally, the issue of looking at volunteering, contributing, giving, and passing on an important role of that older people can do really boosts their self-worth, significance, and meaning. And this really allows, in terms of Maslow's hierarchy, this ability to contribute to people's self-esteem, life satisfaction, and being able to contribute to others. At this point, maybe I'll just ask Linda whether she has any editorial comments to make if her audio is working. Linda.
Thank you, Dr. Wong. Thanks everyone for that presentation. I think we're going to go a little bit past 11 a.m. Eastern here, just so we can get to some more questions. So to start us off, can you address why should countries prioritize healthy longevity now? Why is now the time to be focusing on this, and why by 2050?
Okay, well, maybe I'll start and I'll ask John, Isabella, and if Linda's audio kicks in. Well, I would probably say that, well, like climate change, demographic change is well on its way. And both of these are such complex issues affecting our society that it really requires leadership, investments, policies, innovation, and adaptive interventions, very importantly based on science, data, and metrics across the whole of society before we can come up with ways to address the challenges that Dr. Zhao showed earlier on. If we don't start working on this now, I think that the cost of inaction was again laid out by Dr. Zhao. If we, with people living longer, we have people, if we don't invest in healthy longevity, we'll have a greater proportion of people living longer with poor health and suffering, which will lead not only to increased financial burdens on themselves and their families, lost opportunities, but also increasing challenges to societies and communities. So again, this is something that unless we address this now, and 2050 is not that far away because basically all the 20-year-olds are going to be facing this in their lifetime. And very importantly, by 2050, half the world are going to have populations where 1 in 4 are over the age of 60. And the current definition of a super age society is 1 in 4 over the age of 65. So I think we do have our work cut out for ourselves. And if we don't make this call, and our call is not just the United States National Academy of Medicine Commission, but it's the United Nations, it's WHO, it's the African Union. There are many other organizations making a similar call.
So
John, Linda, welcome.
Thank you. Sorry about my technical problems. I think the flip side to really as a take-home point of the work of this commission is to say there is a very important and set of optimistic alternatives to the costs of maintaining the status quo and the costs of inaction. The evidence points to a very optimistic scenario that health can be extended through longer lives, that all of society can benefit if roles of older people are enabled through a variety of policies and practices, that this requires a shared commitment to building a society for our longer lives now in each country and from a global perspective. And that it's essential to recognize the optimistic narrative of the value of older people in society if their place is enabled. And that the return on investment would be very high for individuals, for their families, for their communities, and for young people and all of society. If this all of society set of transformations were invested in.
No, I agree, Linda. And John, I really like the climate change analogy because I think we're at a tipping point. We're at a tipping point with the climate and we're at a tipping point with the population. And some countries are past the tipping point. So countries like Japan and Germany are actually past the tipping point of population aging. And they're countries which have managed to invest and to put in place universal health coverage. Both of them have mandatory long-term care insurance schemes. They can cover the needs of their populations and they've continued to be able to thrive economically. But other countries are just coming to the tipping point, and other ones should be able to see that far ahead and start to put in place the systems that Linda's talking about, which will enable their prosperity in advance. And those investments for countries where there's not a lot of population aging just yet are not very high because there's only a small population that they need to target. So I think this is a crucial time to invest, not waiting till 2040, 2050. If we don't do it now, then we're all going to suffer as individuals and economically.
Thank you all for that. Next question, how did COVID-19 affect your report and what are the impacts of COVID-19 on demographic trends?
So, oh, go ahead, Jeff.
No, I was just going to say from the health system side of things, COVID-19 just laid bare that the current systems are not adequate. You know, we saw mortality rates, which really we shouldn't have had to see. We had a fantastic response in terms of vaccine development, but the basic systems of healthcare, long-term care were inadequate to meet, you know, what was a global pandemic. And so it made it clear that we have to rethink those systems and come up with new ways of doing things.
I think we also saw quite, and continue to see, the consequences of inequity in every country of the world, both in terms of the health status of people confronted by a novel agent, COVID-19, and the vulnerabilities, particularly of people already in ill health, already with chronic conditions, as well as at older age. These are generally, particularly when these develop at younger ages, consequences of inequities in the access to public health and medical care, as John was saying. And then on top of that, inequities in the way the world has been able to respond in terms of provision of therapeutics. And how unprepared we are is at each of these levels. Certainly investing in healthy longevity, as we have been talking about, across the life course, so that we build cumulative health rather than cumulative disadvantages of health, will be an essential preparation for future pandemics, as well as for creation of a world that can thrive in the face of longer lives.
I fully agree with Linda and John. The only point I would make is that COVID-19 showed us that when you take countries and stress them with a health issue, it affects more than just health. It affects the whole of society. It affects economies. It affects education, and it revealed the challenges that every society has in terms when you're faced with a stress that affects everyone. You know, illness and disease does not certainly a larger burden was felt by an older population, but everyone was affected. The report does call out 5 areas that we should invest in because of COVID: geoscience, readiness assessment, the importance of intersectoral collaborations, the importance of data and analytics, and as John mentioned, the need for rebalancing and redesigning both public health, the healthcare system, and long-term care.
Sorry,
you.
Dana, just before we go on, if I can also add, one of the things which became evident through the pandemic was the way we identify vulnerability by chronological age. And we often said people over 65 are at risk, a greater risk of the severe consequences of COVID than younger people. And that's true, but that's a very crude measure. And what I think we also focused on in the report is that aging is associated with a whole lot of underlying biological changes, which we're only just really starting to understand. And as we better understand those, we'll be much better placed to be able to say who are the vulnerable people and who are not just on the basis of their chronological age, but on the basis of a direct measurement of their health. And I think that's actually very exciting. And if people look at the report, I hope they find that theme coming through it.
Thank you all. Next question. So where will the money come from to pay for everything that you recommend that countries should be doing?
Well, I'll start that off by saying that we were very careful to start with a recognition that different countries will have different priorities and contexts and realities in this planning in terms of what the goals are and what would be meaningful in their country. But we also start with mindfulness that there are some essential foundations that have to be laid in order to really enable the shifts for the long-term future for the young people who will be old people by the time 2050 arrives. And those shifts do require investments. They require creating a floor of financial security in all countries, appropriate to the resources and realities of those countries. But they also require things that don't cost resources, that could unleash the social, economic, and human capital that older people can bring. Investing in the design of new policies and practices that enable people to continue working should they desire to do so. Investment in the creation of new kinds of programs for volunteering in older age so that people can contribute and make a difference in ways they value to their communities and their society. Enabling this kind of social capital will be simultaneously an investment in health and function in longer lives. And our recommendations also bring an eye, for example, in the redesign of the built environment to designing for multiple benefits. We must, every country of the world, be thinking about the physical infrastructure of our countries in terms of being climate change proof, in terms of enhancing sustainability. At the same time, without additional costs, we should be designing for longer lives as well as sustainability. And this kind of planfulness in the first few years with investments in financial security can lay the basis for starting even 5 years out to see a return on investment.
Can I build further on Linda's comment by saying that there are, firstly, some issues which I would say require very little money, but requires a change in our mindsets and the narrative. And I think that the first issue is recognizing that all members of society should be valued throughout their life course because they have interests, they have skills, they have expertise, and they could, and different demographic groups can benefit from each other. So really addressing ageism and calling out the elephant in the room, that does not require money. That requires a mindset. And I think that's fundamental if we are going to unleash the opportunities that this report has shown. The second, I think one of the most important diagrams of this report is the virtuous cycle, whereby if we value all members of society and we create this social compact with equity and social cohesion at the core, we can create a virtuous cycle which raises both the floor of society as well as the ceiling of the society to create greater opportunities for everyone. This will generate both human, social, and financial capital. These will then generate the resources which will enable work, a better physical environment, stronger public health, better health care, better long-term care systems. And this in turn will feed back into promoting healthy longevity and creating that virtuous cycle. So I do think that these and John Beard showed the return on investments just in terms of health, and Isabella showed, again, the costs of inaction. So I think that these investments will really pay for themselves as we go forward, but it requires a change in mindset, and that change in mindset is free.
So if I can build further on what John just said, I would say that it's very important to understand that the change in mindset and the change in narrative can open up an opportunity to see the way forward that will be relevant for any given country. But an outcome, which is critical, is that we are not just preparing the way for young people to be able to have healthy, longer lives, but the investments that are needed so that children have the opportunity for health and education, essential foundations for healthy longevity, but that enabling older people to contribute to society in the ways that we've talked about will also lead to opportunities that to the present are not there for young people to thrive. Many countries are worried that their second demographic dividend of young people moving into the workforce is not succeeding adequately. And we need, in many places, perhaps all places, all hands on deck with older people playing a role to ensure that young people succeed, our future old people.
Well, thank you all. I think we're going to end it there since we went a little bit over. As a reminder, you can access the report at nam.edu/longevity roadmap. And with that, I'd like to thank all of our speakers and thank you all again for joining us today. Have a great rest of your day.